pain on swelling, maybe pain in the throat, you feel like a foreign body stuck in your throat, you have unexplained ear pain, eye pain, and pain on the right side of your face. When I turn my head, I may feel like I get lightheaded. Not always is that a symptom that's associated, but it can be. You take a panoramic X-ray.
I had mentioned you want to have at least 2 diagnoses. Generally, this is going to be your number 1 diagnosis, any of these TMJ disorders, because you're going to put the condition first and your symptom or complaint second. Okay?
So let's give that a try again. Open as wide as you can. Just gently close together and stay right there. And I say, sit. No, he's not pressing on it. He's touching his teeth, but he's not pressing. Fair enough?
Good question.
Pretty much.
Yes,
That's a great impression.
there's absolutely nothing wrong with that.
Conversely, sometimes maybe going forward doesn't do a good job, and you may need to put a device in that gives it a little more vertical to put that tension in the muscle. So when you select devices, think about having.
Now, no one has ever achieved greatness by playing it safe. You can't play it safe. You can't do just that. You have to be on the cutting edge. You have to take that extra step, that extra movement, that extra thing.
They have an ENT, a neurologist, and as well as Dr. Mayoor Patel, who give great information, very useful information that we can take home and actually use in our practice.
Does that cause any pain? Mid-belly, does that cause any pain? No. Stellomandibular ligament on the left, does that cause any pain? No. No. And does that cause any pain? What would you say? No. One.
Every accomplishment that was believed to be impossible at one time, it is possible now. You can do it. Every one of you can do this. Not just me. I'm just one doctor, one physician. One physician out here. You can do this.
Just look at my bag. What I always tell them, I always write them the midline relationship. Hey, the lower midline is shifted by 1 millimeter to the right. So that way they know I noticed that. That way they know I didn't miss it. That's it. That's all it takes.
The sleep paroxysm. So if you have a patient coming to your practice, they're a TMD patient, and they brox, and their chief complaint is that they grind their teeth. Are you going to think about sleep apnea? You probably should.
It's probably your TMJ, articular disc disorder, reducing or non-reducing, which in ICD-9 was 524.63, and now it's M26.63. Okay, so that shows the condition, the disc disorder.